I am Dr. Hema, MD in Homeopathy from Mumbai. I have 15 years of clinical experience of treating patients. Today my topic is PCOD, PCOS. It's very commonly known topic. The full form of this topic is polycystic ovarian syndrome. There are a lot of people who know about this topic. There are a lot of causes known, there are a lot of symptoms known. Today I'm going to talk about something more about this. First, I'll talk about the basic problem, that is the hormonal imbalance. The hormonal imbalance is the biggest problem that causes polycystic ovarian syndrome. I'll talk about the hormones. There are 4 hormones which play a major role in polycystic ovarian syndrome, and the first 2 hormones are from the pituitary gland, which is located in the brain. The hormones from the pituitary gland are FSH and LH. The full form is follicle stimulating hormone and luteinizing hormone, and there are 2 more hormones involved in it are ovarian hormones, the estrogen and the progesterone. So today we are going to understand that the hormonal imbalance is happening. Everybody says that there is an increase in luteinizing hormone. There are immature follicles forming. There is increase in insulin. There is increase in testosterone. But the question is, why is this happening? And why is this happening in 1 in 5 females? The statistics says it happens in 1 in 5 females. The sonography reports which the patients get to me, I see a pearl necklace appearance. Basically, this pearl necklace appearance is the immature follicles which are accumulated in the ovaries. They are the immature eggs. But why this is happening to females? When the female has a normal tendency to give birth to a child, why is the female having immature eggs? Hormonal imbalance we understand, but why hormonal imbalance? So today I am going to tell you that it is basically dependent on the nature of the person. It is very important to know the nature of the person. As I am a homeopathic doctor, I try to understand the nature of the person by taking a complete case history process. Why is it important? The important part is these patients have a normal tendency to accumulate things. They have the nature of keeping secrets to themselves. They are reserved people. They don't like to share their problems with anybody. And as you know, every human being is a social animal. They need to share problems. And why this person is not solving problems? So what they are trying to do is they are trying to accumulate problems in their mind. Our body is made up of cells, and when the cells unite, it forms a body. So if one cell thinks that accumulation is right, the whole body goes into that process of accumulation, and that is why these immature follicles are accumulated. The fat is accumulated in the body. There is a weight gain. So accumulation comes. Why the female starts feeling that she has to accumulate things? Because the basic reason behind that is anxiety. When the person is more anxious, the person is more insecure, they try to accumulate things. And when they try to accumulate things, they think about future. So when they think about future and try to accumulate things, the body also tries to accumulate things. So we have to work on the anxiety, the nature of the patient which is disturbed. For an example, I will tell you that if you have a flowing water from the tap is on. If you try to put your hand to stop the water, or if you try to tie a handkerchief to stop a water, if you put a stopper, is the water going to stop? Maybe it might stop for some time, but it will not stop permanently. So I want to tell you here that you need a permanent solution for this, because the patients who are suffering from PCOD has a weight gain, and despite of trying so many gym and walking, they are not able to reduce weight. The basic reason behind that is mood swings. They have tremendous mood swings which are very difficult to handle. So here I'm going to tell you that just knowing weight loss causes PCOD will not be enough. You have to understand why this person is having so much of anxiety. You can observe this on your own. When you see patients suffering from PCOD, you can also judge that they have more of accumulation tendency. They think more, they try to keep things to themselves. They doesn't talk more. You can also know these things. So when you come across some patients like this, you try to take the case history and you treat the root cause. So what I'll do is, the example, the trap should be off from the root. So from where it is on, it should be off. So once you off it from the root, then you will be able to solve everything. The weight is reduced, the cycles come in 28 days, the insulin levels are normal, there is no acne, there is no hair growth. So it is very important. They also come with infertility, and I have been successful in treating these infertility cases with the same kind of approach, and I'm sure there are a lot of homeopathic doctors who follow this kind of approach. So I just want to share this information to as many of them who are suffering from PCOS, that you will have to work on your nature also. So today is this much. Thank you so much. Thank you for your love. Thank you.